Yes. So when we're talking about pelvic floor and we're talking about the pelvic Kegel exercises, actually. So it is very, very important to understand the bone and this four bony landmarks. So we have pubic symphysis anteriorly, tailbone posteriorly, and both side ischial tuberosities. And the muscle is spanned across this whole area. So you can see this is a diamond shape. It is visible here. So the pelvic floor muscle is a diamond shaped muscle. Like all other muscle, the skeletal muscles of our body, the muscle can contract whenever we want. It can squeeze. We can squeeze it, and it can relax also when we want to let it go something out. So muscle has the property of squeezing, contracting, and relaxing both. And this muscle is under our control. We can train the muscle voluntarily. If the muscle is weak, we can increase the strength. If the muscle is it's hyper or it's tight or short, and we can relax and lengthen the muscle fibers. Altogether, there is approximately 15 paired muscle is present in a female body, and they are 15 pair muscles are coming from right side and left side. They are encircling into the center part. So this is very important to understand when we are understanding the pelvic floor or the Kegel exercise. So Kegel, Dr. Kegel was there in 1949. He was a gynecologist and he was performing one test transvaginally with one female, and suddenly the female she coughed or sneezed. I don't even remember exactly. So she increased that intra-abdominal pressure and she coughed and she sneezed. And his finger was inside the vagina of a female. And suddenly when she coughed, so he felt some movement inside, the Dr. Kegel. And when he found this movement, and then that was a thought came into her mind that what was contracted when the finger was inside, what was that squeezing? He came home and he opened the books and he found out that yes, we have a pelvic floor muscles present. They are the skeletal muscles. So what he started doing with each of his patient, whenever the patient was coming, he was performing the same, contraction, same action with all the patients. And he found out that yes, the muscles are voluntarily, actually, they can create an action voluntarily into this muscle. Then he started asking the patient who are the sufferer of urine incontinence and leakage problem. He started asking all of them that, okay, can you squeeze on my finger? Because he was able to feel the squeezing, how strong the squeeze were. And then he found out that the patient who were not able to perform the good and strong squeeze on his finger, they were having some kind of problems or dysfunctions of the pelvic floor or weakness into the pelvic floor. So he found out, yes, if this is a muscle and the patient is not able to squeeze on my finger, and those females are the sufferer of some kind of symptoms. It can be the leakage, it can be leakage during the sneezing and coughing, or any other kind of weakness into the pelvic floor. So what he did, he started, giving this access. Then he just, like following the same protocol we all are following, that squeeze the muscle for 10 seconds and relax the muscle for 10 seconds. If you squeeze it, we can increase the strength. So in this way, he started giving the same protocol to all the females. Squeeze and hold it for 10 seconds, and then relax for 10 seconds. So this was his protocol. And he found out that once he started this with all the female who were having presence with the symptoms. So he did this study for approximately 2 years, and he found out that whenever the patient is having a weakness and laxity or some kind of weak strength into the pelvic floor muscle, and whenever he is telling them to squeeze, and patients are and telling them this, hold it for 10 seconds, and the patient are performing it. So he did the follow-up, and he asked each of his patient of her patient that, okay, can you please squeeze and hold it and do it for one month, 2 months, and 3 months. And after 3 and 4 months, he found out there was a significant improvement into the symptom. There was no, less symptoms, and muscle power was good after this one protocol. So that's how he introduced to the world that these are the muscles which is present down there, and we can strengthen those muscles. And by strengthening those muscles, by the simple protocol of holding the muscles for 10 seconds, we can have a significant improvement into urine incontinence. And whenever patient is having a laxity or weakness into those muscles, so we can increase the strength. And this how he introduced that to the world by giving his name to that exercise protocol. And he gave him this exercise as a name, Kegel's exercise. So Kegel is behind the name of Dr. Kegel. And this is how he introduced this important aspect to us. He was a gynecologist and his finger was inside. That's why he was able to understand that. But he is not the right person who is working with the muscles. The right person who works with the muscle is we as a physios. We work with the musculoskeletal system. We should have this understanding that this muscle is there and is present there, and we should be able to give those kind of good protocols to our patient. When he introduced this particular Kegel exercise to the world, that these are the muscles, and if the muscles got less power, there are kind of laxities there, and we can increase the power by doing the simple squeeze for 10 seconds and release. So, and the world was there was many questions people were asking him, all the doctors and everyone. So he also introduced one pressure biofeedback just to support his studies. And that was a periometer he introduced to the world. And by inserting the periometer inside the vagina, he was asking the female to create a squeeze, and into the periometer there was the needle, that we have a spirometer present here. So I can even show you. So into this periometer, he was able to used to insert this one device inside the vagina. It has this kind of, the patient female has to squeeze it like this, and when female is squeezing, so this needle is moving up. Like if I'll squeeze that, so can you see the needle is moving up? So this how he introduced to the world that yes, we can check the muscle, and if the muscles are weak, we can train the muscles by giving them squeeze for certain amount of time and 10 seconds. So this is how he also introduced the periometer. But there was many limitations of his whatever the devices he created, because people started telling him that he just want to sell his device, and this was the agenda behind it. But whatever was the history, and it is good for us, it is good for our society, and it was good for all the patients who were suffering from leakage issues. We all know that leakage is not a very new issue. Like old time, it was saying that 1 out of 3 females, they have a leakage issue, or the people, they are having urine leakage issue. Even male and female both, even kids are also there. So because pelvic floor is present in everyone, and the muscles can get weak in each and any case. So, but nowadays, the studies are showing us that this problem is getting worse with the age, with the time, and with our lifestyle also. And it's like not 1 out of 3, we can say 40 to 50% of population are suffering from leakage problem. So what happens into the leakage problem specifically, or pelvic floor, like leakage or Kegel is like connected. So I'm just connecting both of them. And this is how we also understand. If you remember, in our community rehabilitation final year book, it was written in our bachelor's book in community rehab, it was one small paragraph that pelvic floor dysfunctions or urine incontinence, in case of urine incontinence, we can give them Kegel exercises. And in case of any pelvic floor dysfunction, we can give Kegel exercise. So this is how we also assume that, and we also get it, that yes, pelvic floor dysfunction is there, so Kegel is there. So our mind is connected to this particular one fact. And we also studied that in our books. We also heard that from our seniors, from the society. Everyone is telling us the same thing. Pelvic floor dysfunction, do Kegel. So now let's understand what is the pelvic floor dysfunction, and in which cases we have to do Kegel. So specifically, I want to add here one thing, that patient, like the pelvic floor muscle or patient, can have 2 type of problems. There might be the pelvic floor which is present down there, and we have all these organs which is passing through this canals. So you can see we have three openings present here. Urogenital area, we have urethral opening, vaginal opening in a female body. In a male body also we have this penile opening, and we have this anal opening. So through these openings, our organs are, the canals are passing outside. So we have a bladder, we store the urine, we fill the urine, we store the urine, and after that urine is gone, after the filling, urine is going to come out through the urethra, and we like ejaculate. So we evacuate, not ejaculate, we evacuate that urine. So that is going on through the help of internal sphincters as well as external sphincters, which is present all around the urethra. So those internal sphincter which is present at the base of this bladder itself, they are not under our control, but the muscles, this external sphincters, like my fingers, are external sphincters. So they are under our voluntary control. So I'm passing this particular canal, urethral canal, from this one opening here. So it's just behind the pubic symphysis. I'm placing the organ, and you can see how I'm passing it like this. Okay. So after that, you can, in a female vestibule, from here, we have an external urethral orifice. So this is the external urethral orifice present into the vestibular area of a female. And same way, just behind this, just beneath that, not behind, just beneath that, we have another opening, vaginal opening, external vaginal introitus, we can also say. So this is a uterus, and uterus is also having a canal, and this canal is going to pass through this this muscles itself. So just behind this bladder. So let me place this, and you can see how the canal will pass. So now this is a beautifully placed canal, and canal is going to come out like this outside. So whenever we want to insert something inside, like if I want to insert tampon or menstrual cup, or if I want to insert any tablets, or during sexual intercourse, so this is the canal where our penetration is happening. And next is, whenever we are having something is coming outside from this, like every month period blood is coming out, or it might be that during childbirth baby is coming outside. So this is again a canal which is present here, and that canal is passed by these muscles. The muscles are coming from both sides. So you can assume that my one hand is coming, my other hand is coming, and they're merging into the center. And from the center, we have these three canals are coming: urethral, vaginal, and the anal canal, both. So same way, we have our almost very, very posterior situated organ, that is the rectum. So this is the rectum which filled up the stool here, and we have this anal canal, which is the shorter canal from all of them. Actually, the largest is a vagina in a female body, and shortest is the anal canal. Approximately 3.5 to 4 centimeter long canal it is, and is also coming out from this opening. So I'm placing it here. You can see I'm placing it here like this, and the canal will come out from here, and you can see external anal orifice. So there are three orifices are passing through the pelvic floor, and you can see the muscles are having a very beautiful arrangement like around these canals. So as I told you, that's altogether 15 muscles. So those muscles are lying into the layers. So three layers are present: superior, superficial layer, and then it is a middle layer, and more internal is the deeper layer. So if I'll just show you like this, so I can like just make it separate. So externally, these are the four muscles which is present into the superficial layer. One is the bulbocavernosus, which is all around the openings, the central part. So you can understand the bulbo is surrounding the this openings. So if this muscle don't have a strength, it is very weak. So that it might affect somewhere the functioning of the holding capacity of the around the urethra. And not only this bulbo, it is having a very smaller like role into the squeezing. It is not a sphincteric muscles around the urethra, but urethra has the other muscles, urethral sphincters, which is a big part of this middle layer. So this is the middle layer beneath the superficial layer. So this middle layer is, you can see around here, it is having, can you see, this is a looping around. So this muscle is main muscle which work as urethral sphincters or urethral compressors. So two muscles are present. One is the urethral compressor and one is coming from the penile body. Vaginal, ureterovaginal sphincter is also coming here. So that is the main muscle which keep creating a squeeze around the urethra whenever we want to create a hold. So it is a compressor around the urethra. So this is the middle layer, and you can also see this is the anal opening, and around the anal area we have this external anal sphincter. The fact, what I really want to tell all of you is that we have two canals. One is urethral, and another is the anal. Both has to hold something. Both has to evacuate, helps in evacuation. So muscles has a more role in compression. So they have to create a compressive force, so we can hold and maintain the continence inside, and the muscles has to relax also. So whenever we want to evacuate and we want to pass something, the muscle should go and it can relax both. So contraction as well relaxation, both is important. But if these muscles, specifically the external anal sphincter, which is covering the like approximately 100%, I will say 100% part of our anal canal. So this is anal canal around 3.5 centimeter long or 4 centimeter long. So that anal canal is completely covered by external anal sphincters. The name itself is showing sphincters, means it has a compressive role. So this is the pelvic floor. So now if this sphincteric role is not there, the muscle is weak because of any issue. So that means the sphincteric role will be altered. So there will be some kind of issues. The muscle will not able to create a enough squeeze. So not enough squeeze means not able to maintain the continence. So in this case, there might be fecal incontinence patient can suffer from. So that can one issue happen around the anal area. Same issue can happen around this urethra also, because around the urethra, approximately 80% of the urethra is covered by the middle layer, compressor urethrae. If those muscles are weak, which is the sphincteric muscles, so it means the holding capacity of the urine will also, like we cannot maintain the continence, or we might lose that complete property of this muscle. So we need, so it means urine leakage can come into this case, or like during the sneezing and coughing, whenever leakage is there. So it means these muscles are somewhere not able to maintain the compressive force, sphincteric action. So they are weak. Not only that, even we have muscles around the vagina. We don't have any direct sphincters around the vagina, but the lower part of the vagina, if this is the whole vaginal canal, my fingers are pelvic floor, my thumb and my finger. So these pelvic muscles are present at the lower 1/4 of the vaginal cavity, vaginal canal. So this muscles, pubo-vaginalis muscle is the one muscle which is a part of a little bit deeper layer actually. So this muscle creates a squeezing effect around the vaginal area, and because of that, what happened unnecessarily, it's like it will always maintain the closing of the vagina. Vagina is like a condom. We don't want the door to be open and all the bacteria, pathogen to go inside. We need some kind of compressive force around that, so that kind of compression, and even the gravity is also there. So we don't want the gravity just keep pulling it downwards, the internal structure. So these muscles are very, very important muscles and around this area, which create a compressions, and it helps in making this vagina more secure. Even the ecosystem of the vagina will be more healthy because air will not enter inside, and even it will compress you. We need a compressed vagina like this. Okay, and whenever we want to insert something, it should be relaxed. So this squeezing and releasing, as well as not only the squeeze and release, even the coordination. Whenever we want our female to go for urination, the muscle has to, our muscle should know that how it has to relax. Whenever we want to maintain the continence, muscle should be able to get active and create that compression. So this coordination is also very, very important function. Now, I told you, I just gave you a bit of introduction about how the muscles are overlapped around this each canals. Very important is I keep telling you that muscles can contract and muscles can relax. So now, I'll come back to the Kegel exercise again. Dr. Kegel said that whenever muscle strength is weak, we can have 10 seconds of squeeze, hold your pelvic floor for 10 seconds, and you can relax. And in this way, you can increase the strength. So Kegel exercise is actually the exercise for a contraction whenever we want to increase the contraction and strength and the power into the muscle. So in short, like if we want to come into the conclusion, whenever muscles are weak, they cannot hold, or compressive strength is weak, endurance is weak, holding capacity is weak. So I can't squeeze. So you cannot, if I can't squeeze, so in this way, I have to perform Kegel. Hold it for 10 seconds and release. Okay, so that is a Kegel. But when we're talking about the broader term, pelvic floor dysfunction, so pelvic floor muscle can get dysfunction. It can be a tightness also can be a part of the dysfunction, not only the squeezing effect, it can be the releasing effect. Muscle don't know how to relax, or muscle is hyper tonus muscle, or the spasmodic muscle, or shortened muscle because of some issues. So all these muscles, the levator ani, which is the whole big muscle which is present here. So muscles around the anal area, they are kind of hyper muscle. They have a hypertone around the urethra, around the vagina. The muscles are hypertone. So means muscles fail to relax. So in these cases, I think the word Kegel will not be the good word actually to use. So in this way, we will not ask our patient to squeeze, because already the muscles are tight and tensed. Already there is a spasm present into these muscles. Already there is a shortening of these muscles. Anything can happen. So whenever the muscles are contracted, hypertonus muscle, in those cases, using the word, the term Kegel, I think it will be wrong word. So we can't use that. So, but the whole world is doing this kind of practice. Dr. Kegel, he clearly said that when the muscle is weak, when the muscles is weak, at that time, we have to give Kegel. But the whole world, they started assuming that whenever pelvic floor dysfunction is there, we have to give the squeeze, the Kegel exercises. And in my practice, in last 9 to 10 years, I found many, 99% of doctors, urogynecologists, gynecologists, sexologists, they are giving Kegel exercise to each of the patient. If the patients are suffering from constipation, if the patient is suffering from vaginismus, dyspareunia, pelvic pain issues, sexual pain issues, it means the muscles are already tight and doctors are telling them to create more tightness, squeeze more for 10 seconds and like hold it for 10 seconds or repeat it for approximately 10 times or 100 times in a day. So as a physios, we can understand whenever muscle is tight, we cannot increase the contraction. We cannot give them the maximum hold. Otherwise, the effect will be wrong effect. We cannot create extra tightness of the muscle. Okay. So in this case, when the muscle is very weak, we have to focus on Kegel. And when the muscle is hypertone, so in that case, we should not use the word Kegel or contraction. Instead, we should able to help our patient by teaching them the right releasing action, how to relax the muscles, how to remove the all this tightness around this area. In those cases, I use the word whole world is using this word, W-O-R-D word, actually, that reverse Kegel. So if the muscles are loose, weak, you cannot hold something, so do contraction, do Kegel. But if the muscles are very tight and they fail to relax, it means you have to do reverse Kegel. So reverse Kegel, so don't squeeze, focus on release, relax your muscles for more time. So this is the normal understanding of Kegel and reverse Kegel I wanted to give you. And now let me practice. I want to practice, make you all practice with me. Dr. Thiva Kumar, can you please mute yourself? Yes, thank you so much. So that was a small introduction about Kegel and reverse Kegel. So Kegel means contraction and reverse Kegel means relaxation. So we will do Kegel definitely when the muscles has lost its power. It failed to contract. And we will perform reverse Kegel, means more focus will be on the relaxation when the muscles are hyper tight, when they're hypertoned and they fail to relax. I hope I'm clear about this. Did you get my point? If the muscles are loose, weak, sagging muscle, we have to increase the strength. So Kegel, squeeze for 10 seconds. Okay, and if the muscles are over tight, so we have to focus on relaxing the muscles. It means reverse Kegel. Whatever Kegel was telling you to squeeze, we have to reverse that. So don't focus on squeezing, focus on releasing the power of the muscle. Okay, so are you all clear? In which cases we will do Kegel exercise? Whenever there's a laxity, leakage. And in which cases we will do reverse Kegel? Whenever there will be pain issue. Pain is the first symptom. So patient will tell you, I have a pain and difficulty in passing, or difficulty in evacuation, or difficulty in inserting something inside the vagina, inserting something inside the anus, or passing something from the anus or from the this urethra. So painful urination, painful sexual activity, painful defecation, pelvic pain, all these are the issues. Coccydynia also. Okay, they can be the issue where the coccygeal muscles can also be tight. So the muscles are tight, so we'll relax the muscles, and the muscles are weak, so we'll strengthen the muscles. So Kegel exercise will be when we have to increase the strength, and reverse Kegel will be when we have to relax those muscles. So this is the basic understanding I'm giving you all.